Kidney. Today's topic is kidney. It is synonym is renal and its main constituent is nephron. Definition of kidney. Kidney is a pair of excretory organ located on the either side of vertebral column on the posterior abdominal wall behind the peritoneum, and they help in the removal of waste product of metabolism. It removes excess of water, salt from the body and maintains the pH. Location of kidney. Kidney occupies epigastric, hypogastric, umbilicus, and the lumbar region. Now, vertically it extends from the lower border of the 12th thoracic and the center of the third lumbar vertebrae. Right kidney is slightly lower than the left kidney, whereas the left kidney is medial to the plane than the right one, and the transpyloric plane passes above the hilus of the right kidney and below the hilus of the left kidney. Now, the size and the orientation of the kidney. Each kidney weighs about 150 grams in male and 135 grams in female. Each kidney is 11 centimeter long, 6 centimeter broad, and 3 centimeter thick. Left kidney is little longer and narrower than the right kidney. Now the kidneys are bean shaped, reddish brown bean shaped in color and in color. Long axis of the kidney is directed downward and laterally, and the upper pole are nearer to the medial plane than the lower poles. Transverse axis is directed laterally and backward. In fetus, kidney is lobulated. They have 12 lobes, which further during the fet- during the end of the fetal life after the birth, which get fused and forms a smooth uniform kidney in adults. However, the evidence of the fetal lobulation are persistent. Now let's study the external features of each kidney. Each kidney has a bean shape and it has upper two poles, that is upper pole and the lower pole. It has two borders, that is medial border and the lateral border. It has two surfaces, anterior surface and the posterior surface. Also, it contains a hilus or hilum in the center towards the medial side. Now let's study about the two poles, that is upper pole, which is broad and is close in contact with the suprarenal gland, where the lower pole is pointed. Now let's study two borders. There are two borders, that is lateral border and the medial border. Lateral border is convex, whereas the medial border is concave, and it has a depressed part that is known as hilum or hilus. Let's study the two surfaces, that is anterior surface and the posterior surface. Anterior surface is irregular, whereas the posterior surface is flat. Now there is hilum or hilus. That is a structure which is seen that are seen in the hilum from anterior to posterior sides are renal vein, renal artery, and renal pelvis, which is the extended part, which is the extended upper part of the ureter in the kidney. Next comes the relations of the kidney. Kidney is a retroperitoneal organ. Retroperitoneal means it is covered partially or anteriorly by the peritoneum. Common relations of both the kidney. Upper pole of the kidney are related to the respective suprarenal glands, and the lower pole is about 2.5 centimeter above the iliac crest. Median border is related to hilus as following, that is, it is related to the suprarenal gland above the hilus and to the ureters below the hilus. And the posterior relation of kidney is as follows. Posteriorly, both the kidneys are related to diaphragm, medial and lateral arcuate ligament, muscles which are related, that are psoas major, quadratus lumborum, and transverse abdominis. Then comes subcostal vessels and the nerves, that are subcostal nerve, iliohypogastric nerve, and the ilioinguinal nerve. Then comes the right kidney, which is related to 12th rib, while the left kidney is related to 11th and the 12th rib both. The hilus is related to the renal vein, renal artery, and renal pelvis, which is the extended part of the ureter. Now, the other relations of right kidney, that is anterior relations. The right kidney is related to the liver, right suprarenal gland, hepatic flexure of colon, and the second part of the duodenum with the small intestine too. Next is the other relations of the left kidney, that is anterior relations, that is left suprarenal gland, spleen, stomach, pancreas, splenic vessels, splenic flexure, descending colon, and jejunum. Capsule covering the kidney. Prior to that, let's study the posterior relation of the right kidney. Firstly, there is diaphragm, which is related posterior to the kidney, that is diaphragm. Then there is left rib. In case of the left kidney, there is 11th rib too. Then there is medial arcuate ligament. There is medial arcuate ligament and there is lateral arcuate ligament over here. Then comes the subcostal vessels over this way. This is the vein, artery and the nerve. And here the muscles, that is psoas major muscle over here. Then there is quadratus lumborum over here and there is trans abdominis muscle over here. Then comes the nerves, that is firstly subcostal nerve over here, iliohypogastric nerve here and ilioinguinal nerve over this way. Let's study about the covering of the kidney, that is also known as capsule. And there is fibrous capsule, which is a thin membrane attached to the kidney and lines the renal sinus. Normally, it can be stripped off from the kidney, but during certain disease, it becomes adherent and cannot be stripped off. Then there is perirenal or perinephric fat. This is a layer of adipose tissue lying outside the fibrous capsule. It is the thickest at borders of the kidney and it fills up the extra space in the renal sinus. Next is the renal fascia. Renal fascia is perirenal fascia, that is also known as the perirenal fascia, which is originally made up of two separate layers. Anteriorly, it is forming the fascia of Garota, and posterior wall is forming the fascia of the Zuckerkandel. And these two fascia are fused laterally to form the lateral conal fascia. There is pararenal or the perinephric fat, that is also known as the perinephric fat. It consists of variable amount of fat lying outside the renal fascia and it is more abundant posterior and towards the lower pole of the kidney. It fills up the paravertebral gutter and forms the cushion for kidney. There are internal structures of the kidney. Let's have a look at the diagrammatic section of the covering of the kidney, that is the capsule of the kidney. Firstly, this is a kidney which is present. This is the right kidney and here comes the aorta that carries the renal artery and here is the renal vein that is connected to the inferior vena cava. The covering to this kidney is the capsule, that is the capsule of the kidney, and here is the fascia. This is the anterior wall of the fascia and this is the posterior wall of the renal fascia. The anterior wall is known as fascia of Garota, whereas the posterior wall is known as fascia of Zuckerkandel. This space is known as renal sinus, which is filled up with the fat. And here all this is, we can see, is the perinephric fat. Well, here posterior to the posterior wall, yes, behind the posterior wall, here this all fat between the muscle and the kidney is the pararenal fat. Here we can also see three muscles, that is quadratus lumborum, then there is psoas major and here there is trans abdominis.
Internal structure of kidney consists, that is, the coronal section of kidney shows an outer reddish brown cortex and an inner pale medulla.
The space in the renal or the kidney is known as renal sinus. Renal medulla is made up of 10 conical masses that is known as renal pyramids, and there are apical apices which forms the renal papillae, that is forming the minor calyx. Now there is renal cortex. Renal cortex is divided into two parts, that is the cortical arc or the cortical lobules, that is forming the base of the pyramid, and renal columns, that is the deep space between these pyramids. Each pyramid, along with the cortical arc, forms the lobe of the kidney, and the renal sinus is a space that extends into the kidney from hilus. It contains branches of renal artery, tributaries of renal vein, and renal pelvis. And here, the renal pelvis is divided into three 2 to 3 major calyx, and this major calyx divide into 7 to 13 minor calyx. Each calyx is the expansion which is indented by 1 to 3 renal papillae, means that is intersected by 1 to 3 renal papillae. There is blood supply to the kidney. The renal artery is the main blood supply to the kidney, and the renal artery is divided into anterior and the posterior branches. The anterior branches gives off four segmental branches, that is apical, upper, middle and the lower, while the posterior branch that gives one segmental branch, that is the posterior branch. And here the kidney has the following type of blood supply, that is I showed. Firstly, the abdominal aorta at the L2 or the lumbar 2 level gives the renal artery. Renal artery gives the five segmental arteries that gives each segmental artery, and here the lobar artery, that is known as the lobar artery, it gives rise to the interlobar artery. Interlobar artery provides with the arcuate artery. Arcuate artery gives branches, that is interlobular artery. Interlobular artery gives afferent artery, and afferent artery gives afferent arterioles. Afferent arteriole goes into the glomerulus and gives efferent arteriole. Efferent arteriole gives off peritubular plexus. Here, this peritubular plexus combines to form interlobular vein. Interlobular vein combines to form the arcuate vein, and arcuate veins combine to form the interlobar vein. Interlobar vein combines to form the lobar vein, and the lobar vein forms five segmental veins. This five segmental veins combines to form one renal vein, and this renal vein opens into the inferior vena cava. This is the whole blood supply to the kidney. Next is the lymphatic drainage. Lymphatic drainage of kidney is the lateral aortic nodes, which are located at the level of the origin of the renal arteries, that is lumbar 2. Now the nerve supply. Kidney is supplied by the renal plexus and also with the colic plexus. It contains sympathetic nerve, that is T10 to L1, and that mainly consist of the vasomotor nerves, and there is afferent nerves of the kidney, that is from T10 to T12. Now let's study the clinical anatomy of kidney, that is the angle between the lower border of the 12th rib and the outer border of the erector spinae muscle, that is called as the renal angle. Now, the tenderness in the kidney is elicited or disappeared or can be controlled by applying pressure over this angle with the thumb. The kidney is palpated manually with one hand in front and other behind the flank. During enlargement of the kidney, the lower pole of the kidney becomes palpable on deep inspiration. A floating kidney can move up and down within the renal fascia but cannot move by side to side. And for this, the kidney is fixed by suturing the posterior layer of the renal fascia with the kidney. The common disease of the kidney, that is nephritis, that is the inflammation of the nephrons, that is the main constitution, functional, and the structural unit of kidney. Then there is pyelonephritis, that is also kind of nephritis, and here there is tuberculosis of kidney that can be severe. Then there is renal stone, which is most common, and tumors. One of the most common congenital condition of the kidney is polycystic kidney. Here there are many cyst formation in the kidney which are uncontrollable. This leads to the hypertension. And in case of any of the one kidney's failure, hemodialysis can be done in order to alter the work of the kidney. While the failure of both the kidney or in the polycystic kidney, we had to go with the kidney transplantation. Kidney is likely to have a stone as the urine concentration takes place over here.